Good day, and thank you for joining us for another video on women's health. And what we've decided today is we're going to talk about the menopause, the change of life, the dreaded change that many women tend to suffer from as well. And today I've got with me Lindsay Wallace, who is someone who's well versed in the topic of the menopause. She's very skilled and knowledgeable. She's also a physiotherapist with a special interest in women's health and all things health related. And I love that she calls it healthy aging and not just the menopause or hormonal changes throughout a woman's life, but healthy aging. Thank you, Lindsay, for joining me today.
Pleasure, Lanise. Lovely to be here. Thank you for inviting me.
So, Lindsay, how would you describe what the menopause is? What is the definition of the menopause?
Well, the actual definition is when a woman hasn't had a period for 12 months, it is then considered that she is menopausal.
Okay.
There's not going to be another period.
Okay. And I know that we did cover menstruation in another video. So if you're not sure what menstruation is and what those hormonal changes are, you can just go back and have a look at it. Is there anything you feel that we should know about the menopause?
Oh, that's a vast subject. There are so many aspects to cover. And yeah, women are never quite sure what it entails as they sort of journey towards the menopause. And I think knowing more about what's ahead of you is always a good thing.
Absolutely.
So, and the period leading up to the menopause, that is often the more problematic time.
Oh, the perimenopausal phase.
That's what it's called, yes.
Your menopause. What should we know about that?
Well, that can last for 4 or 5 years, even longer in some people. So from mid-30s to early 40s, one can start becoming aware of bodily changes, mood changes, changes taking place from one's normal sort of rhythm that one's in post-childbearing. And one picks up on these things, irregular periods, changes in periods, sporadic periods, but other symptoms as well. There's a multitude of other symptoms which can be quite bothersome.
Oh, wow. So what it sounds like the perimenopausal phase is it's almost a similar effect as the pre-puberty, pubescent phase of a young woman's life, only happening a little later on in life.
That's very much the case.
You mentioned quite a few symptoms. I think most women often associate the hot flashes, a change in weight, the mood swings as a time of menopause. What symptoms would you list or describe that women should keep an eye out for?
Well, often what's most evident to people or they pay most attention to are the hot flushes, which can be very bothersome, and they start saying, oh, suddenly I'm hot, and they don't initially realize that this is a beginning of the change, part of the perimenopausal phase. So hot flushes, night sweats, mood swings, sleep disturbances, other bodily changes which come along with aging anyway, including some vaginal symptoms of discomfort, dryness, itching, urinary tract symptoms. Yeah, there's quite a wide basket of symptoms which go along and can occur during the perimenopausal period. Some people may have a lot of them. Some people may only have the hot flashes.
So it's not that all women will go through all the symptoms as well.
Not at all. And the whole thing is about how these symptoms impact on quality of life.
You mentioned the hot flushes and the night sweats and all of that. Why would this happen? What's happening inside the body that results in all of these symptoms?
Those are the changes in the hormone levels. As one ages and the ovaries are no longer as active, there's a reduction, a drop-off in the amount of estrogen in the body. And that is what also affects the periods. It's the estrogen and the progesterone, the two hormones involved in the female cycle. And with those decreasing, so there are other bodily changes in the vascular system. The hot flushes is all about suddenly the capillaries and the blood vessels opening up. typically in the face. It flushes up through the body, or some people describe a sort of shroud covering them from the top down. So the presentation also can vary, but they are disturbing. Yeah.
Okay. And is there anything I can do about, I mean, you know, we as women are always concerned about our weight. We're never quite satisfied about how much weight we weigh. It's often too much or too little. You want more of this or less of this. And I often joke with the ladies I talk to about menopause is that you go from being pear-shaped, so having your fat distribution, your fat sent to your breasts and your bottoms, to suddenly going to the middle of your waistline, and you wake up with an apple-shaped body as opposed to a pear-shaped body. Is there anything I can do when I am experiencing this as a woman to reduce the change in the weight, for instance?
The big management of a lot of the menopausal symptoms is around lifestyle management. So exercise is vitally important. Small amounts of regular exercise. It doesn't have to be a massive commitment to a gym contract or anything of that sort. Simple walking, a few strengthening exercises are always good, but general housework and activities. People confuse exercise with having to put on your gym clothes and go to gym or do nothing, whereas in fact just a healthy lifestyle means doing activities, whether it's housework, whether it's gardening, whether it's sweeping, playing with grandchildren, deciding to, you know, be active around the home. That's all very important. Yes, get yourself up off the couch and out of the kitchen.
Oh yes, the food aspect.
Yeah, the food.
So not going on crash diets, but actually starting to ensure that when you are having meals, you're more conscientious of the meals you're cooking and preparing and what you're putting in front of yourself.
That's right. Your food choices are very important. So to be informed around what is better nutritionally and less likely also to pack on those fatty tissues around the abdomen, which is not healthy. One wants to avoid that because that's not good for all sorts of other health conditions, cardiovascular.
I was just about to ask about the cardiovascular. So that would be the heart and the lungs and the blood pressure. Are women more at risk after or during menopause of other medical conditions?
Oh, yes. Oh, there are. Cardiovascular or heart disease. So the things that go with that are the high blood pressure, often the high blood sugar, which is more on the diabetes side, but it can be very closely linked, the high cholesterol, increased weight, all of those things compound, and that leads to a high incidence in heart disease in women. Is very high, which one doesn't realize. One always thinks of it as men, but in fact, there's a high incidence of heart disease in women.
Absolutely. And all those conditions that you mentioned are the risk of developing those conditions are reduced with a good amount of exercise and watching what you eat and being more conscientious of the meals you're eating as well. So this definitely comes back to how to reduce the symptoms I'm experiencing by changing my lifestyle. Just because I've changed on the outside, I think sometimes we forget that our bodies are actually changing on the inside as well.
Yeah, that's right. So it's a good time to become aware of one's body and one's body needs and adjust and pay attention to those.
You mentioned genitourinary, so urinary, vaginal, so things between the legs. Yes. Women get changes there as well. And sometimes I think a lot of women just chalk it up to aging and something they've got to deal with. What are some of the symptoms that I need to be on the lookout for? And is there anything the physio or the doctor can help me with?
Yes, Lonnie, there certainly is. So the dryness is very often because, again, of the change in the blood vessels in the area. So there is a reduction in the circulation to the mucosa, which is the lining of the inside of the vagina and around the urethral opening where the bladder opens out, etc. So those symptoms are bothersome and as I said, are often also related to urinary tract symptoms, needing to pee a lot, or bladder infections. The best way to do is just to keep healthy and clean but moisturize with the right sort of moisturizer. They're not always easily available in this country, other than a medicated, something that's prescribed by the doctor, which is an estrogen cream just used in that area. We can't prescribe that. That has to be prescribed by a doctor, but it's quite freely available and inexpensive.
And I can't use things to pucker up down the up on my face.
Well, it's also a bit like moisturizing, moisturizing the face. So,
we often see ourselves in the mirror and we think, oh, the wrinkles are coming and we've got to do something. But I think sometimes we forget that those changes are happening a little lower down as well, and there is something we can change. About the getting lots of infections or running to the bathroom to empty your bladder a lot, and you mentioned something about urethra, so that's where the urine comes out of the bladder. If I find myself having to wear pads or panty liners, or even having to change my underwear because I find that the urine is escaping, is this something a physiotherapist can help with, or do I have to go see my doctor about it? Where do I start?
A physiotherapist with the training in women's health in the pelvic floor muscles can certainly help, but and a doctor may want to test for to see if there is a bladder infection. But very frequently, learning the correct control of the bladder by using the muscles correctly, strengthening the pelvic floor muscles, and learning how to train the bladder so that you're not going too often or unnecessarily, can go a long way to helping reduce those symptoms.
Wow, so it sounds like even though we go through all these horrible changes with the change of life, we can still ease the pressures thereof.
Yeah, there's lots of help available, definitely, in private and in state hospitals.
Absolutely. So even if you don't have medical aid, you can still just ask the doctor at the clinic about these options and tell them about what it is that you as women are experiencing. Because if you don't tell them, they're not going to know what you're going through, and they won't be able to help you transition through this period. And how long would one, I know you mentioned the perimenopausal could be anywhere between 3 and 5 years. How long could I be expected to go through these, like when would it start, when would it end, just to give myself an idea?
Worldwide, they say that 51 is the age of menopause, the average age of menopause. So it starts younger in some people, it goes more quickly in some people. The transitional time is maybe shorter or longer, but usually by the early 50s, everyone has experienced and is postmenopausal, has experienced the menopause. Okay. But if you start skipping periods, you may skip a couple or only have 2 in a year, but unless there's been 12 months since the last one, you're not considered menopausal.
Okay.
Yeah.
Right. Well, I think we have a better understanding now. And Lindsay, is there anything you want to tell the ladies and gentlemen out there? One last thing about the menopause, or have we covered it all?
Well, there's always quite a lot to say, Lonise. If may I just add in, because it's a question that lots of people ask and it's spoken about, is actual hormone therapy, like hormone replacement therapy. So that's quite a controversial topic a lot of the time.
I believe so, because everyone's worried about the cancer aspect of hormone replacement therapy.
Yes, they are. But there's no need to suffer unnecessarily. What one wants ideally is for quality of life not to be disrupted too much by these symptoms, which can be really bothersome. So it's okay to take hormone therapy for up to 5 years, as long as one starts as close to when you're experiencing the symptoms, because that helps you through that tricky phase and that difficult, unpleasant time. Because after the menopause, those symptoms dissipate.
Wow.
So really just a short-term thing.
While those hormone levels are fluctuating up and down, just to smooth things out a bit and make it easier for your body. Wow, Lindsay.
Yeah, a doctor will advise on that though, and always do a screening to see what your risk factors are.
And work quite closely with you. So how are you responding to the hormones that they're giving you?
Yes.
And there's a lot of good research out there showing how well women do on the hormone replacement. And it does boil down to open communication. So really talking to your doctor about what you're experiencing before you get the medication. And then of course, when you are on the hormone replacement therapy.
Yeah.
Anything
Just
else?
one other aspect, which is also, so sorry.
No, I was just about to say, is there anything else you want to tell us? I told you, Lindsay's got a wealth of knowledge.
Well, stop me if I'm going on too much.
No, please do. Share with us.
Just one other aspect, which I think is very important and often neglected, and that is what we call the silent disease.
Oh.
And that's the osteoporosis, the bone density. Bone density in everybody, in women, starts dropping off around the age of 40, 45, 50, and certainly postmenopausally, there's a natural big decline in one's bone density drop off. So paying attention to one's bones is vitally important, although we don't know anything about what's happening in our bones unless we have a scan. But just the awareness of exercise, also correct diet, adequate calcium intake will go a long way to assisting. So if there are other factors causing one to be inactive, those also need to be addressed. To manage weight, for bone strength, for muscle strength, for general health, for mood. So can't say enough about how valuable exercise is.
I was just thinking that there's two take-home messages here. Exercise that's appropriate for you, and we're not saying you need to get a gym membership. And then of course, being more aware and mindful. So just being aware of what you're eating and how much or what types of foods you're eating, and definitely taking care of yourself from the inside out.
That's a very good take-home message, Lonise.
Lindsay, thank you so much. I hope that we have helped people out there understand things better. So if you are experiencing any of this or you are but uncertain, chat to a physio who has got a special interest in women's health, and they would be able to answer some of your questions. And then of course, it always helps to talk to your general practitioner or your gynecologist to answer any of your concerns and questions. Happy exercising and eat healthy. Thanks, Lindsay.
Thank you. Enjoy the journey.